and welcome to New York Links this week for the week of August 17th, 2020. My name is Stephen Sawicki. New York Links this week is a weekly series where we interview someone involved in the delivery of HIV services in the state of New York in order to learn more about who they are, where they work, and the services that are available. Our guest today is Cislin Vasquez. Cislin, thanks for being with us today. Can you tell us more about the name of the organization you work for and what you do for that organization?
Hello, Steve. Thank you so much for inviting me to do this. I work for Pathstone, and Pathstone is two words, merged into one. We are a non-for-profit community development and human service organization serving 7 states and Puerto Rico. So we provide many services to many populations in New York and other areas of the country.
So that's a big area. In New York, what are the kind of services you deliver?
So in New York, our agency is very, broad. We provide housing services. We provide training and employment services specifically to farm workers. And we provide a variety of, human service, programs. I can tell you, from domestic violence shelter, we have programs for the homeless. We have programs, obviously, similar to mine, working inside a correctional facility. We have, what is it? I can't think.
That's okay. You guys are a social service provider primarily, supportive services?
Supportive services pretty much to any, populations, different size populations, different needs in different communities, just in general.
Okay. So New York Links specifically focuses on the HIV positive population. So tell us more about the kinds of services that Pathstone provides to those who are HIV positive.
So I oversee and administer the Pathstone Criminal Justice Initiative, and we've been providing services since 1992. So early on in the HIV epidemic, we've been providing services inside Albion Correctional Facility to the female population in Albion Correctional. So we are part of the Corrections to Community Care for HIV positive individuals and individuals who engage in high-risk behaviors project. And then the project supports a high-impact approach to prevention efforts, providing services in facility and in community to HIV positive individuals, hepatitis C positive individuals, and those who engage in high-risk behaviors.
And how many clients do you work with?
So in an average year, I would say for HIV positive individuals, we work about close to 20. Mainly providing linkage and navigation services.
And you're providing services to them when they're incarcerated. Do you also do when they sort of like post-release work?
Yes, we do. We set up action plans, upon their release, and we pay attention to all the different areas, of the action plan, set up medical appointments in the community. We ensure that the clients have, medical insurance. We connect them to different services in the community, trying to remove any barriers. And, after we create the action plan, we are also following them up in the community. Initially, upon release, we're very, involved in the process. And as time progresses, we have a 6-month continuum of care. So initially, we're very, involved, and ensuring that the client is compliant with the action plan, and to make sure that they are taking care of their health and removing any barriers. And then, as time progresses, we may just check on them once a month, or if a client has, further needs, we continue to work with them closely. But for the most part, they're very independent. And it's just a process that in the beginning we're very involved, and then slowly, progressively, they become more independent.
Okay. So your role, once they're released, is to connect them to existing services in the communities where they came from or where they go back to. Yes.
That's correct. Yes.
So you work with a lot of other clinical and other providers to do that handoff, and then
That is
you stay with the person until they're well connected.
correct. Right now the stipulation is 6-month continuum, but obviously it's case by case for us. If a client needs further support, but again, like you mentioned, working with community-based organizations, working with other organizations in the community, ensuring that the client, we're removing any barriers, and they're pretty stable, and obviously keeping them outside the facility is the goal as well, and keeping them healthy. So we, cover kind of like a holistic type of approach, and the well-being of the clients is number one for sure.
And I'm gonna guess that one of the main things you're working towards with people, both when they're incarcerated and when they're out, is to see that they remain undetectable.
Absolutely, absolutely. Making sure they're attending their initial medical appointment for sure. And that's where the follow-up is so important, because every month, we're following up, making sure, are you engaged in care? Are you, taking your medication? Is there any situations? What's going on with your insurance? So making sure that things are in place to keep them undetectable, to keep them, healthy for sure.
Yeah. So do you look at viral suppression rates as a measure or as a data piece?
So not necessarily under our program. We are paying attention to those areas. We're well informed on that area, but at the same time, pretty much is a collaboration with the client. Internally in the facility, we do look at data for other reasons, but we're not concentrating too much on that. But I can tell you, in general, we have to obviously pay attention to that area, mainly to satisfy obviously our contracts, and to seek further funding. But our data involvement is pretty general, with results, and obviously we need to ensure that the clients are reaching that undetectable, staying healthy, and we have to document that in the systems that we use. Yes.
Okay. If somebody, so let me ask you, so where you get your clients from is pretty straightforward, right? Because you're a criminal justice program, and you get them when they become incarcerated, I would imagine. If somebody wanted to get in touch with Passstone for some of the other services that are delivered, what would be the best way for them to do that?
So We have, if anybody has any questions, obviously, they can definitely reach out to me at, svasquez@paston.org. And they can also visit our public website at paston.org. And, maybe you will be able to find further information in general from all of our services, our programs in the different states that we provide services. And, maybe connect you with the specific person if you want further information or on anything specific.
Okay, that's fantastic. We're at the end of the interview. Is there any last words for those who are watching?
So, I just want to mention, the Criminal Justice Initiative is a network of organizations. We're funded by the AIDS Institute Health Department, working inside several prisons around New York, pretty much providing similar services to both the male, female, and other populations in different facilities. We take great pride and value of the work that we do to improve the lives of the incarcerated population, obviously. And we also collaborate with other agencies in the community. I just want to mention HASA, Department of Social Services, ADA, and other public and private health services providers. So it is a team effort, and we're all working towards the same goal. And I'm just very proud of the difference we're making in the lives of the clients we serve. And obviously, for the facilities allowing us to come inside and do this work, I just wanna, appreciate Albion Correctional for supporting and allowing us, to do this type of work. And we've been doing this since 1992, like I mentioned earlier. So almost 25, if not already 25 years or so. So, the results show. And I've been, working myself in there since 2011. So, we're always looking for innovative ways to serve our populations better. Obviously, a lot of times the information in many of the areas that we provide, the programs, the groups, and other health education services that we provide, doesn't reach in there as quick as possible. So we try to stay on top of, any information that we can bring to the population in there to keep them informed, to keep them aware, to educate, to empower them. So, obviously anything related to the work that we do, HIV prevention, hepatitis C prevention, STD prevention, and other than prevention, healthcare. If you already have, any of these illnesses, then how can we best serve you? How can you stay healthy? And one of the big things we do also is try to reduce stigma, and educate the large populations, and for them to come forward, because a lot of times there is fear, there may be different limitations. So we take it individual approach, client-centered approach. Are you ready? If not, then we may see you at a later time at a different event, because we do a lot of different things in the facility, trying always to stay connected and just serving as much as possible the population in the Albion Correctional Facility.
All right. Well, it sounds like you have some great programs. Cislin, I want to thank you for taking the time to talk with us today. And please extend our thanks to all those at Paston for the work they do and for making a difference.
I want to thank you, Steve, also for this opportunity to promote our programs and, the services we're providing in the community. So thank you very much for this time.
It's been my pleasure. And until next time, this is Steven Sawicki signing off.